everybody, Dr. Waggel here again with Riley,
Hello.
the very intelligent medical student, and today we're going to be talking about off-label medication use.
Yep.
Take it from here, Riley!
Okay. So, to understand off-label medication use, we should understand what an on-label medication is. So, medications are approved by the FDA through a process where the researchers complete a series of rigorous clinical trials. They then submit their data to the FDA where it's reviewed, and it can either be approved or denied as a medication. If it is approved, that becomes an FDA-approved medication that doctors can prescribe to their patients.
So my question is, if you are a drug company, and I'm laughing because I'm thinking so many things, but okay, if you are a drug company and your medication got approved by the FDA and then it's discovered that it helps with something else and doctors are prescribing it for that something else. So the key word being the doctors are already prescribing it for that something else.
Mm-hmm.
Are you going to go back and take all that money and go do the trials over again?
No.
No, because it's already pretty much established that it's helpful
they're very
for this
expensive
thing.
trials.
Yeah, they're not cheap.
Yeah.
So a lot of times, it's found that it helps with this thing. So even though they could, sometimes they're like, nah, we're not going to go and do the testing all over just to show that we can make it on label for this.
Mm-hmm.
And so in my industry, some of the top medications that I use off-label are going to be naltrexone. It's on-label for alcohol use disorder and things of that nature, but I use it mostly for self-injurious behavior. And then it has a lot of off-label uses right now. It's very popular in the current literature, off-label use for naltrexone. Another one that I do quite often is actually prazosin, which is a blood pressure medication, but I prescribe it for PTSD symptoms, especially at night with nightmares and that sort of thing. And then a third very popular one is a beta blocker, propranolol, which is for your heart, and so it's a cardiac doctor's kind of medication. The cardiologists prescribe it, but now the psychiatrists prescribe it. And you know what we prescribe it for?
Anxiety symptoms?
Yes. So it's not my favorite, but it really comes into play if somebody does a lot of public speaking and they want to appear calm, cool, and collected. It has
Give me one now.
Yeah, we both talk. No, I'm just kidding. That's a joke, everybody in the comments. We're joking. But yeah, it's really helpful for public speaking and it makes people not look so nervous. So yeah, that would be a psychiatric use. Definitely not on label. They didn't do the trials. It didn't get the FDA approval for that, but it is used for that.
And the FDA also does have information on their website about the approved use of off-label medications. So there are legal documents stating that while the FDA can control what medications are approved, they do not control what medications doctors may prescribe.
And that's really an important key word there. In fact, when we're editing this video, we'll put that sentence down at the bottom that the FDA cannot control what doctors prescribe. It should be right here. We're going to test the editing skills. All right. Well, I think that covers the basics. What do you think back there, Miriam?
Love it.
Love it. All right. Bye for now, everybody.